Hello, I'm Dr. Valerie McLaughlin, Director of the Pulmonary Hypertension Program at the University of Michigan, and I'm joined today by my colleagues Dr. Richard Chanik and Dr. Ioana Preston to talk about some of the key takeaways from the 6th World Symposium on Pulmonary Hypertension. Dr. Preston, one of the most controversial topics that was discussed was the hemodynamic definition of pulmonary arterial hypertension, and that's changed a little bit now. Tell me what you think that means for us in terms of the diagnosis of pulmonary hypertension.
Well, during this symposium, we looked carefully at the new papers that have emerged from large databases. And what we've learned was that patients who are being evaluated for causes of dyspnea, who have a mean PA pressure over 20, even those between 20 and 25 have worse prognosis, poor survival compared to those who have normal PA pressures. And we've learned that really a normal mean PA pressure is around 14 millimeters of mercury. So taking that into account, the definition, the hemodynamic definition of pulmonary arterial hypertension has changed to a mean PA pressure over 20 millimeters of mercury with a normal wedge pressure of 15 or less in the setting of an elevated pulmonary vascular resistance of over 3 Woods units.
So do you think we're going to have a ton more patients diagnosed with pulmonary arterial hypertension?
Well, an elevated mean PA pressure per se does not mean disease. This has to be put in the context of all other tests that we use as a tool to diagnose pulmonary arterial hypertension. Nevertheless, it is a red flag to investigate these patients more thoroughly to understand what is their functional limitation and how does the hemodynamics play a role into it.
Yeah, and I think the other important point is keeping the requirement for the PVR of more than 3 is going to make this not as impactful as some people might have worried about.
And I think it will help us limit making treatment decisions to really, truly patients who have pulmonary vascular disease.
So, Dr. Chanik, I think one of the groups of patients that this may have tremendous implications for are those that we screen aggressively for pulmonary arterial hypertension. The whole point of doing that is trying to find them earlier, and that's what this newer diagnosis or the definition is trying to get at as well. Tell me what you think of that.
Yeah, I think that's a critical point. If you think about, for instance, scleroderma patients, and we know those are a very concerning group that can progress and really have problems, that's a group where active screening is recommended. And finding patients at an earlier, more mild stage of pulmonary hypertension, I think, can be critical. So having this new definition, I think, will really kind of push that message home a little bit more, that these people, special attention needs to be paid to these people. I do think we do need more data in terms of natural history, in other words, how often they do progress, what are the benefits of treatment in that group of patients at 20 to 25, because we just don't have, I believe, enough sort of longitudinal data and treatment data.
Yeah, I agree with you. We don't have good data on that. On the other hand, just talking about the natural history based on some of the papers that Dr. Preston reviewed, how patients even with modestly elevated PA pressures have a poor prognosis, it's going to be hard to get that natural history data.
It will. I think there's different, it's a heterogeneous group though. I mean, we certainly all follow patients who seem to stay in that mild range and they do okay for long periods, and then others that don't.
But that gives us an opportunity by defining this mild form of pulmonary hypertension to study longitudinally. So hopefully for the next symposium we will have more data.
Yeah, that would be wonderful. Well, Rich, Ioana, thank you for joining me. Thank you for joining us today to talk about the new hemodynamic definition of pulmonary arterial hypertension from the 6th World Symposium on Pulmonary Hypertension.